My thoughts for today on the subject of being alone, a perplexing word. The other night I mused about who I would call if I wanted company and not be alone. Who would I call? The answer seemed difficult to find. My wife mentioned if she goes before me, I should not live in the house alone, but should move to Heritage Estates or similar for sociability. Don't live alone, she said. As I think about being alone, is it not true that we are always alone in ourselves? To go to sleep at night, even though my partner is sleeping next to me, I have to put my thoughts of her aside and become alone with myself to peacefully go to sleep. Alone is where we go to read a book. Alone is when ideas erupt. Alone is where we go to be by ourselves. Alone is where we resolve bothersome issues. Alone in nature is when the beauty of nature sinks in and can be felt. Alone is sometimes what we don't want, and so seek someone to share the time with. Even with my cat, I'm not alone as I think about her and her happiness. Sometimes alone is what we want. I guess I'm trying to get peaceful with being alone. And here's some quotes from Amy Sedaris. I think it's good for a person to spend time alone. It gives them an opportunity to discover who they are and to figure out why they are always alone. And from Orson Welles, we're born alone. We live alone. We die alone. Only through our love and friendship can we create the illusion for the moment that we're not alone. And I don't have the author for this one. If you want to be happy, learn to be alone without being lonely. Learn that being alone does not mean being unhappy. And from Albert Einstein, I live in that solitude which is painful in youth, but delicious in the years of maturity. And from Ellen Burstyn, what a lovely surprise to finally discover how unlonely can be, being alone can be.
You're getting older, you're now on the long, slow road to the nursing home. That wasn't it. How would you know? And you're one of the young guys, Mark.
Hit the spur on one of my handheld devices, both the iPhone and my iPad, and I noticed there's things you can't get to on that. This is the bottom of last week's spur. You might all remember that. That's a picture of the congressman drawing my number out of the hat, which I didn't win. But anyway, down here, there's a little teeny text. There's something that says read more. I bet a lot of people didn't even see that. We're still going to work on making that bigger. But if you'd clicked on that, nothing would probably happen if you're in your iPhone or your iPad. And also, there's two things down here where you can clip on. One to look at all the photos in Flickr of our club, and the other is to look at all the Niles videos. Those don't seem to work.
But only on those devices.
I don't know, does it work? I don't, Samsung work?
It works on my desktop. It works on a computer.
That's right, it works on a desktop.
And a laptop.
Not all the time, it didn't work on mine. Anyway, flip to the next slide. Right up on top, there's something, and also very small print that said, click here to view it in a web browser. That's the best way to do it because you get a much better view. And once you do that, next slide, those things all work. So, for you old folks out there.
Good job, Dave.
Thank you. Yes, Paul.
Talking about
got to see him. He was sitting in a chair. Spirits were really good. Julie said he's
feeling a little bit better. The pain in his neck is getting a little bit less. He's still waiting for an appointment to get an epidural on his neck, which he's been waiting for since June, so it's kind of in limbo. He has things he wants to do, but he's leery about asking us because he doesn't want to feel obligated, so that's why he hasn't asked.
Okay, all
Proud man.
right.
Yes.
I'll give him a poke. I'll give him a poke.
So, today we have a very special program, and you know, it's an organization that's dear and near to my heart and the heart of this club, and that's Access Community Health. We're going to get a really interesting update from Sue Compton, who has served as the Chief Executive Officer at Access since 2007. That's 12 years and counting. She has a Bachelor of Science in Nursing from Duke University and a Master's in Healthcare Administration from the University of San Francisco. She began her career as a public health nurse in rural South Carolina, and her experience also includes hospital and outpatient clinic management positions. In addition to being the Access CEO, Sue is the board chair of the Alameda Health Consortium and is also on the board of directors of the Community Health Center Network. So she's not busy. She's not busy. She is actively involved in public health advocacy work in Alameda County with an emphasis on securing resources for healthcare in the Tri-Valley. So it's my great pleasure to introduce Sue Compton.
That's in the right place. Good afternoon to everybody. Before I get into my long and hopefully not too boring speech about Access, I want to thank everybody in this room for what the Rotary does, not only for Access, but for the community. It's invaluable, and your support truly means a lot to us. You guys get it. You understand there are huge needs in our community, and we're really grateful. Specific to Access, this has helped us a lot over the last few years. The new health center, which opened in 2016, going in and out. The new health center opened in 2016 with your support and the support as well from all three of their cities. You know, shout out to Mark and the city of Livermore and then the other cities that helped as well. Reach out and read. We get a little bit of support every year to buy books for kids in the community who don't otherwise have books. And dental equipment. And I will get to dental in just a moment, but a special shout out to Kathy Coyle on that because she's been an advocate for the dental services all along. So thank you. So Access has been around since 1972. We serve 15,000 people in the Tri-Valley right now, and we have 5 locations throughout the Tri-Valley. And this is what we do. We started as primary care, which means basic medical care. We are not in the business to do surgery and plastic surgery and anything high end. It's basic medical care, and we serve patients of all ages, birth all the way to the geriatric group. We do dental services, which I will get to in just a moment. OBGYN, women's health. We have a very large service in that area, including prenatal care and deliveries. All of our Access babies are born at Stanford Valley Care, about 25 to 30 babies a month. So last I heard, it's about 1/3 of the deliveries at Valley Care. So we keep them busy. We do mental health counseling and something called integrated behavioral health, which is something new. We're very much on the forefront of that. Integrated behavioral health means we look at the whole person. When somebody comes in to see us, whether it's medical care, mental health services, dental services, whatever, we are going to work with that person to see if they have any other issues. If they come in with a headache and it turns out they've got some depression issues, we're going to help them manage that. We take care of the whole person. So that's what integrated behavioral health means. We do enrollment assistance for people to get them on Medi-Cal and other things like Covered California. Medi-Cal, if it wasn't online, if it was paper only, it's 42 pages long, and it's really a pain to do, especially if you don't speak the language real well or you don't read real well. It's complicated. So we help our patients get through that process. We do case management, meaning if somebody comes in for a medical issue, but it turns out they're hungry and they can't feed their kids or pay their rent, we're going to work with them, and we collaborate with all of the human service providers throughout the Tri-Valley to help them with all of the pieces that make a difference in their life. As you can imagine, it's a little hard to stay healthy if you don't have enough food or money to pay for the food. So it's really important to look at that whole person. We have also begun doing monthly food distribution just for our patients primarily, and primarily in Pleasanton, because Livermore has a few more resources than Pleasanton does for food. So that happens on a monthly basis. We do court-ordered DUI classes, and we also have a WIC nutrition program, which is a food voucher program where people get a card, they take it to the grocery store every month. It's only for pregnant women, women who are nursing, and kids under the age of 5. And about 2,000 kids from the Tri-Valley are part of that program every single month, so it gives them some more nutritious foods. These are our sites. The one on the upper left is our newest and our happiest, most favorite place, just because it's huge. It's got 27 exam rooms and 10 counseling rooms. It's 25,000 square feet. It took us 5 years to build it and open the doors, and we're ecstatic. Business got really bigger once we opened that site up. And again, thanks to all 3 cities, because they helped contribute to that, and many community donations to make that project happen. We also are at our regular old Railroad Avenue site in downtown Pleasanton, which was where we began back in 1972. The site is ancient, but it is in the process of being renovated, so we're able to continue using it. It's actually a pretty good location for a lot of patients who can walk there from their place of residence. Bottom left, we are in the city of Livermore's multi-service building on Pacific Avenue, and we've been there since 1980. Huge need, always packed. Unfortunately, it only has 6 exam rooms, so it's not terribly big. We keep asking for more space. I think we have been doing that for 20 years, and that building is really used. Everybody wants to be in that building. So we would expand if we could, but there's no more real estate in that particular building. We have continued our effort to locate more services in Livermore. The problem is your real estate actually costs more than Pleasanton and Dublin. So that's been a challenge. Our original hope for that site that's on the upper left was to put that in Livermore. And after a year, we finally gave up because there wasn't anything we could afford in Livermore. So we got that site because it was during the recession and it was a piece of property that was in foreclosure. So that worked. But future growth is absolutely targeting Livermore. Our newest site is the dental service, which is in Dublin. And then we have our WIC nutrition program, which is also in Pleasanton. We have a staff of 175. That includes, on our medical side, we have 20 physicians and nurse practitioners. On the behavioral health side, we have 18 mental health professionals, meaning that they are all psychologists, LCSWs, or I'm forgetting the other one, LCSWs, MFDs. We provide 100,000 visits a year, and here's the breakdown. I won't go through it, but it gives you a pretty good description of what we're doing. 50,000 medical visits. It's a lot of visits. And everybody's always wondering how we keep our lights on and the doors open. Here's where the money comes from. Medi-Cal reimbursements help us tremendously. That's about 60% of our revenue. We are federally funded. Everybody thinks that's the gold mine and the money just comes and you don't really have to do anything for it. I can tell you otherwise. With that money come just an incredible list of reports and obligations and oversight. And they do own us, basically. There are moments when we wonder if the money's worth it, but it is. So We keep the feds as happy as we can. Our governance is, first of all, we're a licensed community health center. We are a nonprofit organization. And our board of directors is a little different from a typical board. The federal regulations require that 51% of our board be comprised of our patients, of people who actually use our services. So that puts a different twist on a board of directors. These are not just a bunch of rich people who sit around. These are real people who are using our services, and they keep us in check. If they don't like something, or there's a waiting list, or they think we could be doing something better, we hear about it. So I frankly love having 51% of our board be patients. It's really good, and the communication is terrific, and it's important for our patients to be heard as well. Economic impact, a lot of folks think nonprofits are just sort of little mom and pop things. No, we're a real business. We have the same issues that any real business has. We have to pay all of those taxes and follow all of the rules, and we also generate money in the community. In our case, it's about $20 million annually that goes back into the community, whether it's our staff spending their salary on the community where they're working or living, and we buy goods and services, et cetera, et cetera. So we are a for real business, and we operate as such. We have to make a little money every year to keep the lights on. So big part of the day-to-day business. Who are our patients? Here you can see where they live. 43% of our patients live in Livermore. The percentage has dropped a little bit due in large part to the explosive growth that is happening in Dublin. Dublin used to have about 5% of our patients, but as you can see, that's changing. Pleasanton has been at about 20% for most of the years over the last decade or two. Income is interesting. 100% of poverty, that means a family is making less than $24,000 a year. This is a family of four, less than $24,000 a year. The next level up, 100 to 200% of poverty, that means the family of four is making $48,000. Just think about what that means in the Tri-Valley, where the average rent now is around $2,000 to $3,000, and you need to feed your kids and put gas in your car. It's really tough. The people we serve are the working poor. These are people who are trying to get by on maybe $15 an hour, and they have a couple kids and are often working a couple jobs just to make it happen. Many folks think that there's not evident poverty in this area. There really can't be that many people. The demographics show that there are about 25,000 to 30,000 people in the Tri-Valley that fit into this criteria. Poverty is very, very hidden in our community. The typical scenario is there will be an apartment that maybe has 2 bedrooms, and it will have 3 families living in it. So you don't see the poverty from outside. It looks like a beautiful, regular apartment building, but when you go past that front door, that's where the poverty is. So it's definitely in our community. It's just hidden. The age group, a lot of kids, about 25% of our patients are under the age of 21. That geriatric group, 65 and older, is growing. We're up to 14%. And just a few years ago, that was 5%. So we're all aging, our patients are all aging, and that puts an extra importance on the availability of medical care because things get more complicated with age, unfortunately. Our patients, about a fifth of them, about 20%, do not have a car. So we're always very careful when we open a site that it be located near a public service or a public transportation line. Here are the diagnoses. It's really pretty typical of what happens across America. A lot of hypertension, a lot of behavioral health issues, meaning anxiety and depression, and some of the more serious diagnoses there. Obesity and diabetes, it's very typical of what's happening across America and right here with our patients. Of our patients, 68% are on Medi-Cal. Medi-Cal is, it kind of gets a bad rap, but Medi-Cal is an insurance program available to people who are in the poverty income area. And it gives them access to health care. It actually saves all of us money because when they can come in and get prevention and get flu shots and important things like that, they stay out of the emergency room. As you all know, the price in emergency room that's an expensive way to provide health care. So we work really hard with our patients to get them on Medi-Cal and keep them covered with that. Ethnicity, 41% are Hispanic Latino, 26% Caucasian. Asian is exploding. It used to be about 5%, is now 25%. Our challenge is trying to meet the needs of our patients in their own language. And we've got Spanish covered from the moment the phone rings all the way through. The Asian languages are getting to be very challenging. I think we have 17 languages on staff at the moment. It's never enough because there are so many varieties of Asian languages. So that's a challenge at the moment. Dental, our newest and our happy subject. For some reason, dental gets carved out of medical care and it kind of gets forgotten. So over the years, there has been no dental service available for anybody in this community who is poor and uninsured, just plain no care. Our patients were put on a waiting list. They had to go to Highland. The only way they could get into Highland for dental care would be if they really had an abscess and things were going bad fast. Otherwise, they didn't get any dental care. So we opened the site in February of this year. It is in Dublin. We were very fortunate because we found a spot after searching, including Livermore, for a long time, again, looking for a place that we could afford. This ended up being a bit of a gem for us because it was a dental practice in its early iteration that had been deserted. And when we arrived in there, we were thrilled to discover that that site had 5 dental chairs already and x-ray was in place. So it saved us a lot of money on the infrastructure. We have a very long-term lease, again, thanks to the cities of Livermore and Pleasanton and Dublin. That helps pay for those costs. And we opened this in February with 1 dentist. I'll give you some pictures. This was the first day we opened. That was our first patient. On the left is Patrice Lane, who is our dental director. I think some of you have had the pleasure of meeting her, and she has more energy than all of us put together in this room. She's an amazing person. And bilingual in Spanish. So here she is. We have very high-tech electronic health records, which connects to, so the patient's medical record connects to their dental record. So when she sees a patient, she will know if they're diabetic and she can treat them accordingly. So it's, again, whole patient care. Here she is working on one of our little patients. For the moment, because of the phenomenal demand, we are targeting kids and pregnant women only. We will see adults if it's an emergency situation, but we've got to get to the kids and the pregnant women first. That's our first priority. We currently have 500 people on the waiting list, so the need is phenomenal. There she is taking care of this little guy. And a happy camper going home with his new toothbrush. And now, just to leave dental and move on to our site at Railroad. I mentioned that we've been at that site since 1972. It was getting a bit tired, so we are not expanding it, but renovating it so that it can operate more efficiently and be a little bit more modern for our patients. So one of the suites has recently been completed. The first building was our behavioral health site. It gave us 10 counseling rooms. So this is the project, and this is the finished project. It has 10 counseling rooms and a group room as well. This is our next project. There's another Railroad site that currently houses our call center, our medical records department, and our referrals department. This had not been renovated since about 1952, I think. So it's time. The staff had been working in some pretty lousy circumstances. So this is now getting redone. This is what it looks like as of about yesterday. So this is underway, and that will open in October and give us a little bit more wiggle room with all of our services. So I would be happy to answer any questions. Anybody has any?
Yeah, how many homeless do you serve?
Complicated question. The home.
What was the question?
About how many homeless people we serve. We look at homeless folks in kind of 2 categories. First of all is the group that we all see, the people who are under the bridges or hanging out at the fountain, the hardcore homeless. I'm sorry? Unsheltered. Unsheltered, thank you for the technical term. The latest number is that there are 400 and some in the Tri-Valley. So we serve those, but they're tricky. It's hard to get some of those folks to come in for medical care. But we work in collaboration with, there's a mobile health van. We refer back and forth as they find folks who need medical care, and we work with them and bring those folks in. There's a second group of people who are homeless, and this is that other designation, often called couch surfing, or, there are a lot of terms for it. These are people who don't have a home, and maybe they're staying with a friend tonight and with mom tomorrow night and in their car on the third night, and they're moving around a lot. Our number on that is somewhere in the range of 2,000 to 3,000 people. It's fluid, it changes often as people's circumstances change. But there are a tremendous number of people who are homeless and growing rapidly because of the cost of living and the cost of real estate out here. Apartments, as you all know, are prohibitively expensive if you don't have the money. So, yes.
Following up on that, I noticed about a quarter of the patients are uninsured when they come in, I think.
Yes.
And about half of them end up a bit more on Medi-Cal. The uninsured ones that come in, do they end up in Medi-Cal? And what's your
I wish they
conversion
did.
rates
Yeah.
on that?
Really good question. He's asking about the folks who are not insured and not on Medi-Cal. Those are our challenge. We can keep the lights on with a Medi-Cal patient. That covers our cost, not with much extra, but it covers our cost. For those who have no insurance coverage, we need to figure that out in terms of community donations, and sometimes we can get foundation grants and things like that. We also have a contract with Alameda County that is about $2 million. It's supposed to cover some of those costs. It doesn't, it probably covers half of the cost. So we don't turn people away. We do take care of everybody regardless of their circumstances, but those uninsured folks are the ones that are the biggest challenge because we don't have the resources. In most cases, they are people who just can't find the documents to do it. Maybe you were born in Kentucky in 1923 and can't find a birth certificate. Those folks can't get on Medi-Cal without all of the documents that they need to have. There are people who just fall through the cracks.
So at the beginning of your, wait a minute.
Well, you can
Okay, go ahead. You started, okay. At the beginning of your talk, you said there's 53 pages in the Medi-Cal application.
Yeah.
What are those 53 pages
It
covering?
goes through absolutely everything, including how many cars do you own, what's your monthly payment, what's in your bank account, how many kids do you have, is grandma living with you? It goes through absolutely everything in your life and requires documents as well. It's a really intense process. I think, that you hear about fraud and corruption on Medi-Cal. I don't know how many people can get past that because there are so many documents that they have to submit.
Yeah, I have noticed, I saw your percentages, your demographics there. I've noticed in this last year at the food bank where I take my produce from my garden, there's been quite a shift and almost everybody I see is Asian.
Yes.
And I used to see Hispanic families where I take the stuff at St. Bart's.
Yes.
And so I'm definitely, and I asked the woman in charge there, and she said, yes, the Hispanic people are afraid.
Well, I think there are two things going on. First of all, you saw the demographics on the explosion in the population in the Tri-Valley that is Asian, so that's part of it. And yes, absolutely, people are afraid if they are undocumented or they have family members who are undocumented. Yes, they're afraid to approach for services. Yes.
Go Ted, run Ted.
Come on, Ted, run.
How do you handle the need for x-rays, CT scans, PETs?
Yeah, good question. How do we handle the need for x-rays and all of those other things? We do not have an on-site lab for any blood work or anything along those lines. We do have a Quest draw station, meaning our patients can come get their blood drawn at our clinic, and then it is sent out by courier to a Quest lab. We're all electronic these days. We get the results back within a couple hours, so that's relatively easy. X-rays can be a little bit more challenging. We have a contract with a firm that is in Pleasanton that does most of our X-rays. If a patient needs something really high-end, they usually end up going to Highland Hospital, which is the county hospital. Unfortunately, Highland has long waiting lists. A CAT scan in Highland might require a 3 to 6 month waiting, so it's tough to get in.
I have a question.
Sure.
You were saying the documents back to filling out all those papers to help these people. Is there a service you offer to help walk them through that?
Absolutely. We have 8 full-time people on staff. That's all they do every day, all day, is they meet with patients as they come in and as they enter into our system of care. They work with them, they usually spend an hour on that first visit assessing to see what they're eligible for. If it looks like Medi-Cal, they'll start that process. If it looks like they're eligible for, there's some other public programs that are lesser known, but they are eligible for other things. We will walk them through all of that, help them gather their documents and track it. Medi-Cal also requires that everybody re-enroll every 6 months. Yes, yes. I think the intent in Sacramento is the more difficulty there is in getting through that process, people will drop off. But we work with them, we keep them on.
So, one question.
Sure.
If a family comes along or an individual comes along, and for whatever reason they cannot get Medi-Cal or any other services, what do you do with those people?
We see them. Those are the people that I talked about earlier who are uninsured, and we see them either with that county contract, which usually runs out by halfway through the year, and then that's where the community
So
donations.
the county contract would pay for them to do that?
It covers some of those costs,
Okay.
not all of them.
And the rest you eat?
Yes,
And you must document that?
absolutely. We
So-
document everything to keep
So
Washington happy.
percentage-wise,
Yeah.
of costs, for those costs versus your total costs, what's that percentage?
Our average visit cost is $200. That includes lab, x-ray, and pharmacy. So I'm proud of that number. I think it's if you price out medical care anywhere in the public or in the private sector, it's way more than $200 a visit.
I meant on
So-
an annual basis, so
Yeah.
uninsured costs versus total costs.
We have to make up a difference of about $1 million a year for we don't have a contract to cover.
Out of how many millions?
23 million is our total
So
budget.
5% or
Yeah,
4%?
yeah.
Okay. Okay, thank you.
We're doing good.
Okay, I didn't want to.
We're doing good.
Okay.
I'll let you know.
Okay,
Yeah, thank you so much. Very powerful presentation.
thank you.
Now, with 6 months turnaround with regard to the Medi-Cal and 8 staff on board, now there are a lot of high school students that do have need community hours. Now, or even volunteers, my Rotary. If you have volunteers, how do you deal with HIPAA? Do you
Yeah.
cover that? Like a quick training before and.
Yeah, that's actually a very complicated question. We are obviously covered by HIPAA and about 12,000 other regulations related to patient confidentiality. For that reason and some other reasons, we typically don't use teens as volunteers, and for a couple reasons. First of all, teens talk to each other. However well-intended, they talk to each other, or they see somebody, or the word gets out, I saw that person in the clinic yesterday. So it's a little problematic to have teens be a volunteer in our clinical setting. We do use volunteers for our food distribution program and some of the more external things where there's not access to a medical record or anything along those lines. Does that answer what you, okay.
What about the Rotarians?
Thank you so much, Sue. I get to tell one story since we have time. When Kathy and Pat and I went over to tour the dental facility, and Valerie took us through and introduced us to Denise, we just fell in love. Because it's a part of the story Sue didn't tell you. She's a Pleasanton native come home. She grew up in Pleasanton, went to what, SC, to USC's undergraduate, and someplace like Columbia to dental school, did a year or so in Central or South America, and then came back where she wanted to come to, which was back home. Just a great story.
Yeah, it is. She's a graduate of Amador.
Yeah. So thank you so much. We have 2 obligations for you. You have to choose.
Oh, that's not a hard one.